right, welcome back and thank you so much for staying with us. You're watching TV47 Breakfast. My name is Annie Udida and I am an Arsenal fan. Last week, we had started a conversation that today we want to continue from that particular point. We were talking about dental health in pregnancy and early childhood. And we started by telling you that did you know that there is a direct link between your oral health and your children? Dr. PJ Muriuki. You know, last week I was shying away from saying your name because I don't want to butcher it again. Yes. And I'm not going to mention it again on this show. So Dr. PJ was here last week to walk us through everything that we need to know as far as this particular discussion here is concerned. Dental health in pregnancy and early childhood. Karibu sana daktari.
Asante sana.
Thank you so much once again for making time.
Karibu.
Nakumbuka, I promised that I was going to talk to Mary to bring you again so that we can continue.
Yes, yes.
Because there's a lot that we talked about and there's a lot that we didn't talk about as well. Largely we focused more on the mom the other time.
Yeah.
And today maybe as we transition now to the dental health of the child, then I think we can pick up from where we left it from last time, just yes. to give our viewer who wasn't able to join us last week a brief intro and summary into what we tackled last week. But you're an Arsenal fan.
Yes, I am.
And I'm going to give you a chance to brag about that as we start.
Thank you so much for, again, having me this morning. And a very good morning to our viewers.
Yeah.
My name is Dr. PJ Muriuki. And, something has changed since the last time I was here.
Yes.
We are champions.
Yes.
The champions of England after so many years waiting. And we couldn't be more proud for this moment.
Right now, if you introduce yourself, you say, my name is Dr. PJ Muriuki, and I'm an Arsenal fan.
Oh, here we go. This is PJ Muriuki, and I am an Arsenal fan for many years.
I love it. Sorry.
Good. So, again, thank you for having me as we continue this journey of demystifying dentistry. And like you said, last week we had a very nice conversation about the issue of pregnancy, oral health in pregnancy, because there are a lot of myths about that. And we were able to see the importance of taking good care of your oral health during pregnancy. And we busted a few myths, which included the myth that you are not supposed to visit your dentist when you're pregnant, that you cannot have some procedures when you're pregnant. We say that it is indeed important, even before conception, that you visit your dentist. Secondly, we say that there are some procedures that are very safe to have during pregnancy, and we say that the second trimester is usually the best time to have that. Another thing that we talked about...
What are these procedures, Doctor?
Yeah, some of these procedures...
Things like cleaning of the teeth, filling for those who have cavity maybe, and treatment of just various infections. So I know somebody might be wondering, what are these treatments and all?
All right. So like we said, the most important thing to know is that whoever is attending to you should not be treating the tooth. You should be treating the person who has a tooth problem, which is very different from treating a tooth. So there are some measures that have to be put in place, including checking some vitals, your blood pressure and all other things that need to be checked. Procedures that are safe to have include what we say are procedures that can prevent you from getting to an emergency during pregnancy. So the cosmetic procedures, for example, are not recommended during pregnancy because this is something that can wait, all right? So if you need whitening, bleaching of teeth, crowns and stuff like that, those ones can wait until you are able to have them safely after delivery. But things like even cleaning, extractions, fillings, can safely be done during pregnancy, but again, I have to give a rider that it is on a case-to-case basis. Your doctor should be able to evaluate you and be able to tell that this procedure can be done. Another thing that we talked about, just to give a recap, is the issue of the fact that whatever is happening in your body will also affect your oral health. We talked about, some women experience vomiting during the first trimester. And this vomitus that comes into the mouth has a lot of acid, which burns the inner surface of the teeth, which causes what we call erosion, and this erosion can lead to damage of the teeth, and you can have a lot of sensitivity during pregnancy. And this is something that most women experience, and it is because just of the whatever is coming from the gastric acids, it's burning the teeth, eroding the outer, the outer layer of the tooth and making the teeth to be sensitive. We also talked about the hormonal imbalance, the estrogen and the progesterone that are you know, in the body, and you know, that imbalance also affects the pH in the mouth, makes bacteria that ordinarily are symbiotic or good bacteria to be harmful, and this is why we get women saying, "I lose a tooth with every pregnancy." You know, so we said it is not that the baby needs calcium from the tooth. That is a myth. It is actually just because of the many changes, like you said. Those people who vomit, we've talked about the issue of cravings and all those habits that usually come with pregnancy and the hormonal imbalance. And lastly, we spoke about the fact that whatever you do as a mother during pregnancy can affect your unborn child. We talked about the issue of fluoride. We talked about the issue of fluorosis, the issue of consumption of water that has high fluoride, especially from boreholes. And we also touched about the issue of that fluoride is good when used topically. When you use it to brush your teeth, it is an angel, but it can be a devil if ingested. So in a nutshell, that is what we were able to talk about.
Right. I love how you've captured everything quite so beautifully, even as we start. But the issue of, you know, mothers who lose their teeth when they're pregnant, is that something that should be of concern, or is it a normal thing? Because I see a lot of this online, especially now. There are women who, you know, are telling us more about their experience when they were pregnant, you know, as far as, you know, dental care and health is concerned. So if somebody loses their teeth, is that something that should be of concern to her?
Yeah, I always say that, you know, a tooth is like, you know, a diamond in your head. You are not supposed to lose a tooth. I normally give the analogy of your fingers. If you have a problem with a finger, you don't go to the doctor and they chop it off. Or you have a problem with your leg, the first thing they think about is chopping it off. It is really sad that we've normalized the issue of losing teeth, and yet that is not supposed to happen. So part of what leads to that is what I'd say is neglect, all right? Where people neglect their teeth, and we talked about the oral seeking behavior amongst our people, where you find that most people just go to the dentist when it is very late, so that there's nothing that can be done. Whereas if they were able to do that earlier on, then they'd be able to have preventative measures to ensure that they don't lose teeth. So it is not okay, it is not normal for you to lose a tooth during pregnancy, or even for men who don't get pregnant. You know, they are not supposed to lose their teeth. And like I said, it is all those three factors that we talked about. Those factors of habits, the factors of the hormonal imbalance, the factors of whatever is happening in your body, the vomiting and all those things, they accelerate. Probably you had a small cavity, all right? But now because of this sudden change, there is an acceleration of the disease, right? And that's why we said, even before conception, actually in some countries, some developed countries, part of the routine of you know, when couples are planning to get pregnant is actually when you go to your gynae, they'll tell you go to your dentist also. Because like we said, also some of these things can also affect even fertility, like what we said about gum disease, having a direct link through research on the fertility. Yes.
But now, what is not recommended during pregnancy as far as dental care is concerned?
So what is not recommended is, number one, you are not supposed to have, let's start from the basics. You see, most people when they have toothache, for example, or they have issues with their teeth, the first thing they do is what? They run to the pharmacy to buy medication.
Right, painkiller.
Painkillers. You know that, these painkillers are harmful to the unborn baby. All right? So you can imagine, I've seen patients who tell me every time I have a toothache, I've been going to the pharmacy and taking this medication and all that. And this is harmful. Now that we're talking about, pregnancy and the child. This is harmful because some painkillers, like NSAIDs, the Brufen and the likes of those medication, when taken during pregnancy, they can affect the unborn child. For example, if you take painkillers during the 3rd trimester, sometimes there's a hole in the heart that usually closes during the 3rd trimester. All right? So if you take painkillers during that time, especially the NSAIDs, what will happen is that that hole will not close, and that's when you hear babies born with a hole in the heart. All right? Some of those things are harmful. So number one, you are not supposed to just self-prescribe. If you have an issue with your tooth, you're supposed to go to the dentist, and they should be able to advise you accordingly. Number two, in terms of now the treatment, what should be done is, ideally, in an ideal situation, is what is done before conception, which is more of preventative, making sure that those, let's say, for example, if you have early gum disease, or if you have incipient caries, that is cavities that are just starting, they are sorted before the changes that will happen during that time. However, should you have a problem during pregnancy, and this is something that we see a lot, you'd find that the tooth, a tooth that is paining during pregnancy can even precipitate premature labor, because having a toothache is one of the worst pains that you can have. So you can imagine you're having this toothache, and like we said, the mouth, people usually remove the mouth from the body. It's part of the body, so it can even precipitate even high blood pressure. All right? Then high blood pressure can lead to preeclampsia and all those other things that can lead to a very eventful delivery and pregnancy. So you are supposed to visit your dentist. There are ways that they can deal with that. And the other thing that I have to mention here, because especially in public health system, you normally see this a lot. You'd find that someone is expectant, then they are told that they are not supposed to visit a dentist. Number one, of course, that we've already busted, and we said that indeed you're supposed to visit a dentist. Now, the other thing is, if you have an infection, or you have a tooth that is infected during pregnancy, the chances of you getting a very bad infection is very high. All right? Again, because of the changes that are in your body. All right? So you'd find that, and there's a case, I think you guys carried in the news, of a mother who actually we lost, died because of a toothache. Because what happens is, where the tooth is, there are some things that we call potential spaces that are linked to the neck and to the chest. So whenever you have an infection and you get a swelling, that swelling is actually pus that usually accumulates around the bone. Potential spaces are spaces that are in between the planes of muscles. So when you have an infection and your immunity is a bit low, or even have some conditions like diabetes, the probability of that infection descending down to your neck and to your chest and spreading throughout the body to get what we call sepsis is also very high. And this can actually be very fatal. So immediately you see that you have a toothache and you're pregnant, please just visit your dentist. An extraction can be done, all right, safely, but it has again to be done by a professional. You ensure that you are going to a professional.
At any point, in your pregnancy, any trimester.
Like we said, ideally, 2nd trimester is the safest. But again, you, as a doctor, you are supposed to make decisions, all right? So if, for example, you still saw even a patient, we have attended to patients even 2 weeks to delivery, because you look at it and you see now this has potential of becoming a severe infection and descending down to become fatal, right? So at that point, we have measures in collaborations with our other colleagues the gynecologists and the physicians. We have measures that we can be able to institute to ensure that we safely manage that patient without, causing any harm. So it can be done at any particular point because they are what we call dental emergencies. However, like we say, there are procedures that can wait, cosmetic procedures, restorative procedures.
Yeah.
Those ones, please, just wait it out and then you can have it after.
Yes. So when you talk about sometimes an infection can now develop into a very bad infection, it means it's not only happening in the teeth, this bad infection, but it can also cause other, infections in the body, especially, in the lung area, or where exactly?
So there's a condition called Ludwig's angina.
Yeah.
All right. So Ludwig's angina is a severe infection that is mostly odontogenic, meaning it usually starts from the tooth. All right. So you have a cavity or gum infection, then the infection spreads down, because actually a cavity is a bacterial infection. It is actually a bacterial infection of the tooth. All right.
Yeah.
So if this bacteria is left unattended and it descends down to the nerves of the tooth and where we have the blood vessels, because a tooth has blood vessels. All right. So when it gets to the blood vessels are interconnected with the rest of the body. So the first place that it's going to go is to the roots of the tooth. All right. Where are the roots anchored? The roots are anchored inside the bone. That is the jawbone. So the infection spreads there and gets to the root, and it forms what we call a periapical pathology. All right. That is on the root. And when it forms that infection on the root, let's even call it pus. The pus accumulates in your jawbone.
Oh, wow.
That is when you get a swelling. I'm sure you've ever heard people saying, my tooth is swollen.
Yeah.
All right? That is actually pus, which is swollen around the root and the jawbone. Now, remember, like we said, the tooth, the blood vessels, they're all interlinked all the way back to the heart and all those things, right? So when that infection, again, is not sorted at that particular point, what will it do? It will start spreading extraorally, meaning that it goes to other places. The way the face and the neck region is made is that there are spaces that are not there, but they can be there. We call them potential spaces.
Yeah.
All right. So potential meaning that should there be an infection, it will find its way down. And when it gets to the front of the neck, it now starts compressing your trachea. Okay, the trachea is a windpipe that we use for breathing.
Yeah.
All right, it compresses there, and actually you now start having difficulty in breathing. You'd find that these patients are really struggling to breathe. Their nostrils are flared. Their tongue is out. We actually call it the hot potato syndrome.
Yeah.
You see the way if you bite a hot potato, the way you react.
Yes.
So you'd find that their tongue is out. They are trying to breathe through the mouth. There's a swelling that has come to the anterior of the neck.
Yeah.
And this was evident, I'm sure, to our viewers, of the man that we unfortunately lost to a quack in Kawangware.
Yes.
If you watch that video, you'll see that there's a swelling that is underneath the jaw all the way to the front of the neck. So that is an infection that spread from the tooth down to the bones to the potential spaces, found its way to the anterior of the neck. And now that becomes a dental emergency, because if decompression is not done, surgical decompression is not done, and medication instituted, you can lose that patient. Actually, we normally say it can be fatal even within 24 hours, because it will affect your airway. And most of the time, especially when the patient is immunocompromised, either they have those immunosuppressive conditions or even pregnancy, what will happen is that infection can spread to the anterior of the neck. Anterior of the neck goes down to the chest, all right? So when it gets there, we call it necrotizing fasciitis, because it has gone all the way to the...
Yeah.
So it is no longer now...
Doctor, today you're using big terms. Kwani, you don't want us to understand?
So that's why, we just said it goes to the front of the neck, then it descends to the chest.
Yeah.
And now when it gets there, most likely you are going to get spread of the infection through blood. So meaning that it can go throughout the body and that is what we call sepsis.
Right.
So sepsis is basically spread of an infection throughout the body. So we started with a cavity that is not attended.
Just
someone
tooth.
ignored a tooth.
Yeah.
Someone got an infection of a tooth, ignored it, took painkillers, never got resolved, got a swelling, the swelling descended down. And if you are not careful, you can lose this patient. And unfortunately, again, our oral health seeking behavior, kuna watu watakuja amesema huyu amerogwa, you know, they don't understand how a tooth can, and that's why we are here to create awareness. You'd find that they present very early, very late, you know, wameenda kwa daktari wa mitishamba, daktari kutoka Pemba, everywhere. So by the time they are coming to Dr. Muriuki, it is too late. Probably the infection is already a sepsis, and in that case, the patient has to be admitted, a lot of strong antibiotics given, surgical debridement in theater to be done. So just from a small thing that could have been sorted very early on. And it is important that we are talking about pregnancy, because pregnancy sometimes can lead to this, you know, escalation of an otherwise a problem that the body would ordinarily be able to fight.
So are pregnant women more susceptible to toothache or tooth problems, Dr.?
Yes, they are. They are very susceptible because of, like we say, the behavioral changes, snacking, they like eating all sorts of things. Then again, the hormonal imbalance causes the pH of the mouth to change. And we also talked about some of the things that happen during pregnancy, including vomiting, can also lead to that. So they are very susceptible to this. They are very highly susceptible to gum disease. They are highly susceptible to what we call oral tumors. So there's a particular, we actually loosely call it pregnancy tumor, where you find the gums get really swollen, all right? They bleed a lot, all right? Where you brush and you find that you're bleeding a lot. All that is linked to, you know, this, the condition of pregnancy, where there's a lot of changes that are happening. So yes, to answer your question, they are very susceptible to some of these conditions, including now gum disease, acceleration of cavity. It doesn't mean that the cavities might form during pregnancy. They could have been there, but now they've worsened during pregnancy because of all those things that we've talked about.
Right. Now there's a video that I saw online while I was preparing for this, you know, discussion last week, that there are some pregnant women who, you know, while brushing their teeth, they feel they nauseated rather. They want to, you know, vomit because of that feeling. I don't know what happens to them that, you know, it makes them feel that way. But then it gets to a point when our pregnant women cannot really just brush their teeth, as simple as it sounds. Then what alternative is there for, you know, this particular group of pregnant women? Yeah,
that's a very good question, because actually there is usually a lot of irritation and nausea, you know, that comes with that, to the point where there are women who tell you that I'm not able to brush at all. Actually, even seeing a toothbrush makes me nauseated, right? So it is a really valid concern. And like we said, that is why it is important even before conception, because you don't know, especially for first-time mothers, you don't know how your body is going to respond. It is therefore important, and I'm happy, especially now with the young generation, you'd find that they plan their things, right? Most of them plan their things. You'd find that, like last week I had a patient who came and said, you know, I'm planning to get pregnant, can I have braces?
Oh, wow.
Right? So you see, that is a good conversation to have, because now you can imagine that is part of the reason why pregnant women experience those things of saying I lost a tooth during pregnancy, because if you don't brush and you know, you stay that way for long, it means that you are susceptible to developing cavities during pregnancy. So now you see the connection. It is not just it is not calcium, or I did not have calcium, so I had to lose a tooth or something like that. It is even those habits and those, you know, the circumstances where you are not even able to brush. Now, in such cases, we normally, the most important thing with brushing is not actually even the the actual, commercial toothbrush and stuff like that.
Yeah.
Our main aim is to disrupt plaque formation.
Oh, yeah.
What is plaque? Plaque is a combination, we call it a biofilm. It's a combination of food leftovers and bacteria, all right, that stay in, that environment, get stuck to the tooth. And now this is what causes a tooth to have a cavity and also causes the gum to get inflamed to the point where it's bleeding. So by brushing, you disrupt formation of that film on the tooth, which can cause damage. So our main aim with brushing is to disrupt it. So in such a case, we even encourage people to use you can use mswaki, ile ya kijiti, you can either use that, all those things. You can also use mouthwash, right? Because mouthwash, especially like chlorhexidine-based mouthwash, they are antibacterial. So when you shush around your mouth, it's going to suppress the concentration of the bacteria, and it will prevent your tooth from getting exposed to those harmful bacteria. So whatever it takes, whatever is comfortable for you to disrupt the formation of the plaque, that should work, including even wiping your teeth. If that works, you just do whatever you need to do. And also you can use mouthwash to just rinse around the mouth.
All right, great. And the conversation, once again, that we're having this morning with Dr. PJ is about dental health in pregnancy and early childhood. I want us to sample some feedback at this point. Our social media handles, TV47 Kenya on Facebook and on YouTube, and on X at TV47 Digital. Our WhatsApp line is also active, 0793 267 279. Where do we start on Facebook? And we start on WhatsApp. Mercy, watching from Roysambu, says, Doctor, I'm 5 months pregnant and my gums bleed when brushing. Is this normal or should I be worried? We have Jane from Nakuru, and she says, Daktari, when is the right age to take a child for their first dental checkup? That is a good one. We'll be transitioning to that as well. We have Faith from Embakasi, and she says, I'm a mother of 2 and my child already has cavities at age 4. What could I be doing wrong? All right. Cavities at just age 4. Susan from Nyeri says, does pregnancy weaken teeth? I lost 2 teeth after having my last baby. Dr. has talked about that. Susan, thank you so much. And we do have Anne from Kisumu. She says, my baby sleeps while breastfeeding at night. Can this affect their teeth? My baby, can that affect their teeth, Doctor, if you capture that question? I don't know if we should start from that particular point or we wait for that transition, then we can pick up from that. But you mentioned something quite interesting that I'd love for you to clarify, that sometime, the now generation, they come to you guys and ask, can I have braces if I'm planning on getting pregnant? Can they have braces?
It is not a strict contraindication, but like we said, as a rule of thumb, is that something that is cosmetic should wait. That's the rule of thumb. It's not a strict contraindication. But now I want you to picture this. You're having braces, they're stuck on your teeth, then you get into your first trimester, and then you find that you have a lot of nausea, or you are not even able to brush. What that will do is, when you eat, braces also pack food in between. You can imagine now you are not even able to brush. So this will lead to even more severe gum disease, all right? And you can easily get acceleration of an accelerated rate of getting cavities. All right. So now that you don't know how you are going to be, the best thing is just to wait it out. All right. It's not a strict contraindication, but it is recommended that all cosmetic procedures, including alignment of teeth, which is just for cosmetic reasons, can wait until you are done with pregnancy. and that is usually what we recommend.
Right. Yes. And I love that you've also spoken to the signs that pregnant women should be looking out for as far as their dental health is concerned. Somebody also asked about gum bleeding when they're pregnant. I'm sure you talked about it as well. Yes. Or you want to give more? I know you answered it.
You already captured that.
Somebody
said it's just because of the hormonal changes, and actually they are more susceptible to even get, sometimes even they get a huge swelling on the gum.
Yeah.
Yeah.
All right, and of course we thank you so much for sending your questions, and we do encourage you to keep sending them on our digital platforms, TV47 Kenya, across the board. Now, I want us to transition to dental health in early childhood. At what point should a parent start, looking at the dental health of their child? Now they are here, we've taken care of us also pregnant, but now the child is here, they're breastfeeding, they're actively breastfeeding, and most of, first of all, start us off from there before I throw so much at you. Yes. And then we'll come back to the next question.
All right.
Yeah.
Thank you. This is a really important subject that we are tackling about early childhood, because again, it forms the basis of how your oral health is going to span out even during your adulthood. First things, to answer one of the questions that was asked, when are you supposed to even start taking care of your baby's teeth?
Yeah.
Actually, you're supposed to take care of them even before you see them. All right? What does that mean? You should start brushing your baby's gum pads even before the teeth come out. So how do you do this? Of course, the baby is not able to rinse and do all those things. Yeah. So what we recommend is you wipe them. You wipe them with a soft cloth after breastfeeding. All right? You just wipe, just put it in the mouth and just wipe around the gum pads. What does that do? Number one, of course, it ensures that the baby has fresh breath, and because even if they don't have teeth and there's a lot of accumulation of the milk in the mouth, they can have a certain smell that comes out of that. So just cleaning is good. Number two, it establishes a routine. All right? This routine, the baby gets used to it from the onset, so that you will not struggle when it comes to the time of brushing. So once you breastfeed and just before they sleep, just take a moist cloth and just wipe on the gum pads, because this will also make them used to things being put in the mouth, and it will be easy for them to brush. Yeah. Secondly, immediately the teeth come into the mouth, which is usually around 6 months. It is important that this routine continues. And there's one of our viewers asked a very nice question about breastfeeding. Yeah. So remember, breast milk has a lot of sugars. All right? Now, when you breastfeed, especially during the night, just before the baby sleeps, there's usually some milk that is left in the mouth. Yeah. So basically what you're doing is those teeth will be soaked in milk which has very high sugars. All right? And we know that sugars lead to formation of cavities. Yeah. And that is why we say that when this happens over a long duration of time and the parent is not able to clean these teeth, and by wiping them, even if they are very young, what will happen is that these teeth will start developing cavities. All right? And our recommendation, actually, it's loosely called baby bottle caries. Yeah. Baby bottle caries, because you find there are some kids, either they sleep breastfeeding or they use the baby bottle, the mnyonyi. They have the mnyonyi all the time. Yeah. Just before they sleep, there is milk that is left on the teeth, and the teeth are left soaked with the milk. And you'll find that some parents will tell you that my baby's teeth are starting to mottle. Zinaanza kuvunjika, zinakaa whitish, zinaanza kupata cavities, all right? In some severe cases, you even get teeth that have broken. You're just seeing some black stumps on the teeth, all right? All this from early childhood, when they were breastfeeding and they were using a lot of milk and not cleaning the teeth, this can lead to people getting cavities. So, and we normally call it early childhood caries, or sometimes you can even, that is when it happens within 72 months, that's after up to 3 years of age.
Yeah.
And this now, remember, the teeth that they form are the ones that will be carried to, into their early 5 years, 6 years, all the way until now the permanent teeth start coming out. So there's one of the viewers who asked about her 4-year-old having cavities on teeth.
Yeah.
It starts from that time. From the time that the teeth come into the mouth, you'd find that they breastfed and they were not cleaning those teeth. So you don't have to use a brush. The moment the teeth, a baby is, let's say, less than 1 year old and they don't have the reflexes and all those things, just use a cloth after every breastfeeding, wipe. Even if it is at night and they are sleeping when they are breastfeeding, just wake up and just wipe their teeth to reduce the amount of sugars.
All right. There was a comment from Anne. Anne was watching from Kisumu, and she also asked a question about her baby breastfeeding at night. And she asked, can that affect the teeth of her baby?
Yes, it's exactly what we've said, that indeed you are actually supposed to wipe the teeth after breastfeeding. There's no problem with breastfeeding because, I mean, that's what a baby should do.
Yeah.
The problem is letting them sleep without cleaning their teeth. So you're supposed to make sure that you wipe their teeth immediately they fall asleep, all right? So that you remove the sugars that are from the breast milk. And if you don't do that, you're going to get baby bottle disease or develop into early childhood caries, where you find that almost all the teeth are affected, and mostly you'll find that it is the upper teeth. Why? Because the lower teeth, we have saliva.
Yeah.
Saliva is a natural cleansing agent. And also on the lower side, we have the tongue. So the tongue just moving around just cleans those teeth inadvertently. But for the upper teeth, since they are not in direct contact with the source of the saliva, you'd find that they are the most affected, especially the front upper teeth. So it is okay, breastfeed at night, but as a mother, what you're supposed to do, immediately the baby falls asleep, just take a warm moist cloth, just wipe the teeth, and it will make a whole lot of difference. Yes.
Dr. Sometimes we hear a lot about not kissing the child, that you should not be kissing your child on the lips. If you could just clarify that for us, how that affects the dental health of your child in the long term, or if that's a myth, if at all.
Yeah, it's not recommended really, because I mean, this is a young child. Number one, we talked last week about the mouth having a lot of bacteria.
Yeah. And
I mean, this is a young person who's not been exposed to the environment like an adult. The same way that you would not expose them to, cold or things like that, because they are having innate immunity. Basically, they are depending actually on the breast milk for their immunity.
Yeah.
They've not yet formed their own immunity. So if you have a cold or you have some harmful bacteria in the mouth as an adult, and then you are kissing the baby, you are basically transferring that to the baby. There are even adults who have a particular bacteria that is very monotonous for bad breath.
Yeah.
Now when you do that to the baby, what are you doing? So it is not recommended that you do that. If you have to, just do it on the cheek. I mean, just let the baby alone. Have they even consented for it?
Very interesting. Yeah. And talk to us thumb sucking, because we see, growing up, my mother especially, she's very much against kids who, suck their thumbs. How does that affect the teeth of the child? And sometimes they say that it's also a contributing factor to a lot of kids having their teeth projected outside. Yeah. Then how does thumb sucking really play out when it comes to dental health of the child?
Right. Again, a good question. And we generally call these habits parafunctional habits. So these parafunctional habits would include thumb sucking, They also include even tongue thrusting, lip sucking, okay, where the baby sucks on the lower lip. Now, some of these habits are self-soothing habits for the baby, right, where they feel just comfortable doing it. They are okay up to a certain age. You see, if they are sucking their thumb when they are little, it will not affect them as much. But now when they reach a certain age, let's say 4 or 5 years going up, it will now become detrimental because, you know, with you are supposed to wean off these infantile, they're called infantile habits, all right? So if you suck your thumb, what you're doing is you're actually applying pressure on the upper jaw, all right? Remember, this is a growing child. When the child is growing, there are spaces in between bones, including the palate. We call them sutures. So when you apply pressure for long, what will happen is it's like you're pushing it out. So you'll find that the upper jaw is so in front compared to the lower jaw. And that gives them a very, you know, unique posture, what we call a class 2 face profile, where the upper jaw is so protruded compared to the lower jaw. And it's not a nice thing because that's not how they're supposed to be. And you'd find the teeth are really protruded outside. With that, protrusion of the teeth will lead to 2 things. Number one, speech. You'd find that because there are some letters that you pronounce with your teeth together. When you suck your thumb, you get an open bite at the front. So this open bite means that the front teeth never meet, the upper front teeth never meet on the lower side, on the lower teeth. So it leaves a space at the front. This will do 2 things. Number one, it will affect speech. You'd find that some words cannot be said by someone who has an open bite. You'd find they're saying the, you know, because the tongue goes to the front to try to conceal that space that is formed by the open bite. Some words you have to have, when you're talking, the teeth have to contact. So it might bring speech issues. Number 2, you see the lip, when you have, the teeth and the lip are supposed to close your mouth. It is actually part of a physical barrier. All right? The way you have a door in your house. That door is supposed to prevent strangers and things that you don't want to get into the house.
Right.
So when you have an open bite, it means that you have what we call incompetent lips. The lips are not meeting. So all the time, the teeth are out and there's a space that is there. So this will lead to a lot of things getting behind your mouth. And these kids, you'd find that they always have Homa, all right? Because there's a lot of stuff that is getting through the air unfiltered. Because you are not supposed to breathe with your mouth. You're supposed to breathe with your nose. Why? The nose has some hairs and some sinuses that clean the air before it goes down. But now when you have an open bite, it means the air is going in unfiltered and it will lead to what we call upper respiratory diseases like Homa and pharyngitis and all those things. So it is not only a dental problem, it will lead to other things. And this can also lead to snoring. Because you don't have a seal at the front of the mouth. You'd find that these kids snore a lot and you know, it can lead to other things in the ENT area. So indeed, these parafunctional habits, thumb sucking, tongue thrusting, will not only disfigure your dental formula, but it can lead to other systemic conditions, including, you know, you've had parents saying, mtoto wangu anashindanga na homa all the time. Yeah, it could just be from just an open bite at the front of the mouth.
Does pacifiers also do the same?
Yes, prolonged use of pacifiers also, you know, it forms a habit, you know. They are good, like I said, initially, but you are not supposed to make them a routine, you know. Most people find it cool, but, you know, just it should not be all the time the baby. You know, they also need to exercise their mouth, they need to exercise their tongue, to develop speech and all those things. But you find some parents all the time, they have pacifiers and find it very cool, whereas it's actually to the detriment of the baby.
All right. Dr. Let's get some more feedback. We are talking about dental health in pregnancy and early childhood. TV47 Kenya on Facebook and on YouTube. We start off from WhatsApp. Lydia says, Daktari, are bleeding gums during pregnancy a sign of poor dental health or hormones? We also have Sharon from Kitengela. She says, I fear visiting the dentist while pregnant. Is dental treatment safe during pregnancy? That turned to Lyongelea. Sharon, thank you so much for that. Esther from Ruaka says, my child hates brushing teeth. How can I make brushing fun and easier? That is Esther from Ruaka. We also have Mary from Mombasa. Daktari, is it true that baby teeth are not important because they will eventually fall out? Oh, wow. All right.
That's a good one.
That is a very good question. And finally, Kevin from Eldoret says, as parents, how often should we replace our children's toothbrushes? Where should we start? Because a lot of lovely questions have come in, Daktari.
Yeah.
Tuanze na hiyo ya mwisho ya Kevin.
Yeah.
How often should parents be replacing their child's toothbrushes?
All right. So you're supposed to ideally to replace it after every 3 months, even for adults. But we normally say if you had a bout of sickness, let's say, for example, you had homa, even as an adult, it is important that you replace that brush. Also, there is a way that you can disinfect your brush, just making sure that you soak it, even in salty water and things like that. But ideally, as a rule of thumb, 3 months, or when you find that the bristles are flat. Because now, if they are flat, it means that they are not able to clean properly. So, but also when there is a bout of especially respiratory conditions, homa, it is important that you replace, because it can also contribute to reinfection. Another question that I liked a lot. Yes.
Esther from Ruaka. I'll help you with that.
Yes.
Esther from Ruaka says her child hates brushing their teeth. So what can they do to make that particular experience wonderful for their child?
Excellent. It's basically what we talked about, that we need to institute these brushing habits all the way even before the teeth form. Because some of these kids, when a habit forms, routine forms a habit, all right? So when you start cleaning the gum pads with just cloth, all right, by the time they are reaching 1 year, you might graduate to a brush, and they'll not find it weird because they are already used to the cleaning of their gum pads and the teeth. So this will definitely develop into a habit even in the early childhood, and they would really love to do that. If that is not done, and now we find ourselves here, how do we make it fun? Number one, make it a family affair. All right? Make it a family affair and a routine, where we normally say you're supposed to brush in the morning after breakfast, all right? And in the night as the last thing that you do. I normally say brush in the morning to keep your friends, but brush at night to keep your teeth. All right? So what that means is, of course, during the day, you don't want your mouth to be smelly. But at night is when most of the damage of the teeth happens. Why? During the day, you are eating, you are talking, the tongue is moving around, cleaning the teeth, and the bacteria don't have an ample time to cause havoc. But at night, what happens? Your mouth is just free. So they are free to roam wherever they are, in the mouth, and cause all the havoc. So make it a routine, like, for example, after breakfast, all of you brush, because it's called role modeling. As a parent, if you are doing it, then you'd find that your child, not even brushing, everything, you'd find that your child tries to mimic what you're doing. So if you make it a family affair that after eating your dinner, you're going to brush, they will definitely do it. But what do most parents do? End of brush, But them, they're not doing it. And kids are more of, they mimic what you do.
Visual learners.
Yeah, they actually tell, show, do, Once you do it as a family, they'll actually not need any other motivation. Also, there are fun things, including like fancy toothbrushes that have some flickering lights that you can get that are very nice. You can have even ultrasonic brushes, the ones that are, they vibrate on the teeth. You can even have timers, because you're supposed to brush your teeth for 2 minutes. There are those hourglass But now these ones are like 2 minutes. So you just give them and then they flip it over, tell them to brush until the sand gets to the other side. So there are many ways that you can institute this, but the most important and effective method is just modeling, where you do it as a family.
Right.
Yes.
Mary from Mombasa also asked a question about, she hears a lot that the child's teeth are not important because they will eventually fall out. You can just, and is that a myth, first of all?
Yes, and we are here to bust it.
Yeah.
So it's indeed a myth and a very bad one, which is unfortunately also propagated by quacks or underqualified staff, just to give a reason why they should extract your baby's tooth, you know. So teeth are meant, there's a reason why those teeth grew, or why God gave us those teeth. If they are not important, tungezaliwa bila tukae tugoje 6 years, then permanent ones to form, or we get the permanent ones from the onset.
Yeah.
Milk teeth are very, very important, and I'll give 3 reasons. Number 1, function. Teeth are for eating. So if you go to a dentist and they remove a tooth before it's due to come out, what does that do? It is actually incapacitating your baby's ability to eat, where they'll not be able to feed normally. And you'd find now these kids are the ones who eat this soft food because they're not able to eat, because most of the cavities that happen in the mouth are on the back teeth. And they only have 2 molars for chewing.
Yeah.
So if you remove them, what does that mean? So they're important for function. Number 2, they are important for speech. All right? Like we said, teeth are important in development of speech. If you lose these teeth early, and this is the time when, you know, when babies are below 5 years, that's when they are learning how to speak and all that. Teeth are important in development of speech, and there might be delay in development of these milestones of speech because of losing teeth. All right. Thirdly, those teeth, the milk teeth, are important to maintain space for the permanent teeth. I'll repeat, they're important for maintaining space for the permanent teeth. And this is where problems for most adults begin, where you find that they had their milk teeth removed. What happens is, when a tooth is removed, that space shrinks. When it shrinks, it means that when the permanent tooth will be ready to come, it will not get space. And that is why you find people saying, oh, mtoto wangu akona home. There is a tooth which is growing on top of the others.
Yeah.
It is usually because of that. Most of the time you find you lose a tooth which was meant to, you know, ni kama venye unaambianga mtu nishikie kiti na come, you know.
Yeah.
If that person leaves, most likely that seat is going to go also, right? So if that tooth is there to maintain space for the oncoming tooth, and then you remove it, it will mean that that tooth, by the time it's coming, that space will have already shrunk, and the teeth will start growing from the side. And that is how you find that most, okay, not most, but some adults have teeth that are not properly aligned.
You're talk to me direct. Like, I see, but you know, we've come to the end of this conversation. My teeth are beautiful.
Yeah, very nice smile.
Yes, thank you. We've come to the end of this conversation, but I would want to request my director to give you some time to give us a parting shot. Just daily habits that now should be normalized by both the pregnant, you know, mom and of course for the child, that will in turn just make the teeth healthy for the child and for the mom. All
right. So I think what I'd say is prevention is better than cure. And good news is oral conditions are preventable. So prevention by making sure that, number 1, you visit your dentist regularly. That is at least once or twice a year. Number 2, brushing. If you brush in the morning and you brush before you go to sleep and you use the right technique, I think the next time I'll come with a model and show people how to brush. That once you do that, it should be fine. Number 3, especially for pregnant women, it is important that you visit your dentist. And yes, don't wait until you are in a lot of pain for you to visit. Just ensure that they are qualified. I know that we have a lot of questions. Probably what I'd say is For those ones who would want to ask more, they can find on my social.
Right.
On Facebook, it's PJ Muriuki. On Instagram, it's Dr. PJ Muriuki. I think Twitter is also the same. So they can just inbox, and I'll do my best to try and answer all their questions. And finally, we have, like we said, oral health seeking behavior. We ensure that we visit the dentist. You don't have to go to private facilities. Like, for example, in Nairobi County, we have a lot of our facilities having dental services. You can go to Mama Lucy, Mbagathi, Mutwini, but even the health centers nowadays have facilities that can be able to attend to your needs.
All right. Thank you so much, Dr. for making time for us to have this conversation. I'm holding my phone because it's a very beautiful comment I've seen. Just allow me to read it, and then Dr. maybe you can meet her outside. And she says, I'm 37 weeks pregnant and having two painful teeth. Only using Panadols. I think we talked about it, and we said it's okay. It's okay to visit the dentist.
Yeah, they should, actually, it's wrong now to use that
Panadol.
Medication. Those medications can affect the baby.
All right, Dr. I'd allow you for the very first time this season to introduce yourself once again as you give them your bye-byes, the way we did when we were starting this conversation.
Right.
I told you what to do.
All right. Thank you. It's been a pleasure to be here talking about what we've talked. My name is Dr. PJ Muriuki. I'm the Director for Dental Services in Nairobi City County, and I am an Arsenal fan.
Good. You're a good student. Thank you so much once again. My name is Annie Odida, and don't go too far. Today being a Thursday, we're still talking matters health, and I'm an Arsenal fan. Stay right here. Thank you, Dr.
Karibu sana.